Stigma is one of the fundamental challenges faced by people who use drugs when seeking access to care. This can result in people delaying or avoiding seeking care and services for fear of being judged, turned away, or treated badly. When people are not able to access the care that they need due to stigma, it can be deadly. So how can stigma be reduced so people feel safer and more willing to access care and services when they need it the most? That is what Scholar-in-Residence Dr. Bernadette Pauley is seeking answers to.
The Island Health Scholar-in-Residence program was launched in 2015 to build organizational capacity for research, and specifically research that engaged patients in the design of the research as a way of improving and informing better healthcare services. We know that there's something like a 17-year gap between research findings being generated and being put into practice. As the Scholar-in-Residence program brings that much closer together.
With overdose deaths sweeping the province, the SIR program couldn't have come at a better time.
What makes the information gathered by this program so valuable is that it's knowledge that's been generated by people with lived experience, people who can identify what the barriers are, but also what the facilitators are to improving access to healthcare.
When we engage people with lived and living experience in the research that we do, we're better able to really get at the kinds of evidence that's going to make a difference to people and their care, in terms of whether that care meets their needs, whether it's delivered in a way that is accessible to them.
I was about 8 months into a 2-year stint where I was homeless. I was unemployed at the time, had all kinds of potential, and I didn't know where to direct it. So this led to me getting a job in a recovery house, and then down the line it led to me moving over to Solid Outreach. So it had a huge impact, changed my direction, gave me purpose in life. In our community, it's very common knowledge that you don't want to end up having to go to the hospital. People will wait until it's too late to go get healthcare as a result, and problems get worse. I spent my whole life avoiding the healthcare system because I didn't trust the people within the system. This project gave me a voice.
Due to the effectiveness, the program was extended, and an additional $2.5 million in funding for further research has been secured through various funders, including Canadian Institutes of Health Research and Health Canada. Reducing stigma and providing timely care means listening to the needs of those with lived experience. The SIR program is awarded the Gold Apple winner of the Dianna Mah-Jones Award of Excellence in Person-Centered Care Award, generously sponsored by Health Benefit Trust.